Hey everybody, this is Dr. Grimmett from Forge Physio. Today we're going to be going over ways to facilitate knee flexion or knee bend. So we have an exercise ball. This is one of the movements that we do with a ton of our orthopedic aftercare for individuals who have knee replacements, ACL type injuries, any sort of ligamentous, pretty much any knee surgery. And then a lot of times we'll see this with people that have ankle injuries because of what it can do up the chain with limiting some of the mobility. And then lastly, with a lot of that weight bearing restriction, stuff gets kind of stiff. So we like to use an exercise ball. And then what we're gonna do is go to our back. So the first thing is just starting with nice and gentle range of motion. So if I bring the ball closer to me to where my feet are on the top, when I go to straighten it, a lot more of my limb is going to be supported by the ball. That's going to feel more comfortable. And then when I go to roll back, my feet stay higher relative to the ground, so my heel doesn't come toward my butt, so I don't get as much knee motion. So typically where we like to start is just nice and simple, keeping my entire low back on the ground, bringing my knees toward my chest, and then letting my legs go straight. And then I like to cue like that quad set, or at least firing up my quad to be able to straighten my leg. And then pulling heel to butt and pausing. Now with this, you can get as creative as you want. So what I mean by that is a lot of times the knee will feel stiff as you go into flexion. It'll feel stiff as you go into extension. So what I like to do is have my clients push their heel down into the ball and then rotate their foot toward the camera, and then rotate their foot toward the wall. And oftentimes we'll put a yoga block between their knees here, so that way their hip is not taking over for the lack of motion in the limb. So you can add some tibial rotations, is what we call this. And then you can keep that tension. So say I push my heel down, I point my toe to the camera, I can straighten my knee a little bit, pause, rotate my foot across, keep the heel pushed down so there's tension in my hamstring, and then now bring that knee or that heel toward my butt. So now my foot's pointed in, now it's pointed toward the camera. And what I'm trying to do is keep pressure into my hamstrings and drive that rotation of the tibia, which is gonna help clean up some of that knee motion. And then if you go to relax and you go to straighten it, typically when you go to do that quad set, you'll feel less discomfort through the quad. And then when you go to bend it, you'll feel less discomfort in the back position. So say that gets too easy, what I can do is from this position, I can scoot the ball away from me. So when I go to straighten it, I'm gonna have more hanging that occurs because my limb is less supported by the ball. And then when I roll my heel to my butt, my feet are gonna drop lower, which is gonna create more knee flexion. And then what I can do to that is go back to that neutral position, right? So I'm about 90 degrees, and I can push my heel down on the ball, and I can add that rotation in, rotation out. I can do it to where I rotate out, start to straighten my leg, pause, rotate in, and reverse out of that. You can be as creative as you want. All we're trying to do is drive into the area of restriction without increasing symptoms. If you get tightness, stiffness, those types of things, that is normal and to be expected because we're trying to explore joint space to give that knee more motion to be able to move. And then the other way that you can progress this, it's a little bit harder on a ball like this, but you can go to one limb, right? So that allows me to just get a little bit more isolation into that limb. And then for me, what I like to cue people to do eventually is like, say you can get really good at restoring that rotation, you can just simply kind of get to here and help pull that heel toward your butt as long as your hip has the flexion to be, your hip has the range of motion, excuse me, to be able to go into flexion. So if that irritates your hip, obviously do not do that. But the moral of the story here, we're just trying to drive motion in an unweighted position. So you can be as creative as you want. Watch the video, go through the progressions, find and do whatever your limbs can tolerate without increasing your symptoms. And then each subsequent session, you'll notice you'll be able to have a little bit more range of motion without having as much stiffness.